I have gotten so many requests to do a video on dark circles and addressing the under eye area in general, so that is exactly what we are going to discuss today. If you are new here, welcome. I am Dr. Berg, and I am here to help you understand your skin and find products that actually work for you. If that sounds good to you, give this video a thumbs up and don't forget to subscribe. Before we can even begin discussing treatments and interventions for the under eye area and dark circles, it is really important to understand what causes them. If we don't know what we are treating, how can we make the right choice? The under eye area is incredibly complex anatomically. You have bony tissue, muscle, fat, ligaments, and varying skin quality. All of these contribute to a less than desirable look. There are so many different factors at play, and the reality for most people is that they have more than one issue going on. It is rarely just the skin or just the fat. It is how they combine and overlay one another that makes the under eye a problem area. As we go through these potential causes, keep in mind that you might have a combination of issues, which may require more than one type of treatment or intervention. It helps to break under eye issues down into categories, the first being pigmentation, and the second being anatomical issues that lead to shadowing. Let's talk about hyperpigmentation first. Number one is true hyperpigmentation. What I mean by that is that the skin itself is dark, which can be caused by a few different things. One is melanin deposition in the skin. Melanin is the natural pigment that gives our skin color, but some people inherit an excess deposition of melanin around the eyes, especially those with darker skin tones. We see this a lot in Middle Eastern and South Asian populations. Often, patients will tell me that everyone in their family has dark pigment around their eyes, which is frequently just excess melanin. Melanin production and deposition are also triggered by UV exposure. People who spend a lot of time outdoors without protecting their under eye area with sunglasses or sunscreen often develop a darker appearance there as a result. There are also certain skin conditions that lead to excess pigment around the eye. For example, melasma, while more commonly seen on the forehead and cheeks, can absolutely affect the under eye area too. Then there is post-inflammatory hyperpigmentation, which is essentially a deposit of melanin anywhere there has been excessive inflammation or irritation. If someone tries a product under their eye that is incredibly irritating, their under eye might look darker afterward due to that post-inflammatory response. You can also have irregular pigmentation due to a different type of pigment called hemosiderin, which comes from broken down red blood cells. As we age, the vessels under our eyes become a bit leakier, and red blood cells that belong inside the blood vessels can seep out. As they break down, iron gets deposited in the skin, leaving a rust-colored to yellow-brownish stain. We often see this in older populations because their blood vessels weaken over time, but for people with chronic seasonal allergies, it can also happen from continuous inflammation, irritation, and rubbing. Speaking of seasonal allergies, that brings me to the third cause of skin hyperpigmentation, skin thickening, a condition known as lichen simplex chronicus. This is essentially the skin's defense mechanism against being chronically rubbed. It thickens up, and as it thickens, it looks darker. So those are the primary causes of true hyperpigmentation under the eye: melanin deposition, hemosiderin deposition, or skin thickening. However, another reason you might see discoloration is that the skin under the eye is so thin that you can see right through to the underlying structures. The two main structures visible through the skin are blood vessels, and the orbicularis oculi muscle, which surrounds the eye, helps it close and pumps out tears. The fairer and thinner your skin is, the more apparent these structures will be. They tend to look bluish, purplish, or even green tinged. You might think you have a dark circle, but the skin itself isn't discolored. You are simply seeing through to the vessels and muscle underneath. The way you can distinguish whether you have true hyperpigmentation or are seeing through to underlying vessels and muscles is with the pinch test. Be gentle, as the skin under the eye is delicate. Simply take 2 fingers and pinch the under eye skin up. As you pull that skin away from the muscles and vessels, take a look at it. If it still looks pigmented or hyperpigmented, the issue is within the skin itself. If the skin you pulled away does not look pigmented, you are more likely seeing the vessels and muscles underneath. Keep in mind you can have a combination of both. The skin itself might be slightly hyperpigmented while you are also seeing the underlying structures. That covers pigment. Now let's talk about the other category that leads to the appearance of dark under eyes: shadowing. Shadowing can be attributed to a variety of anatomical issues, the most common being hollowing under the eye. A lot of hollowing comes from the natural aging process. As we age, bone resorption occurs, meaning our bones shrink. The orbital bone around the eye widens, and the eye can sink back slightly into the skull, creating a hollow appearance. Our cheekbones can also shrink down, leaving the under eye with less support, which further accentuates that hollow look. Aside from losing bony tissue, our under eye fat pads change as we age. They don't just shrink and become thinner, they also descend. That loss of both bony and fat support makes the under eye look much darker. You can also have genetic hollowing. Patients in their 20s or early 30s will often come to me and say, "Dr. Berg, I've had dark under eye circles since I was 5 years old. I can see it in my childhood photos." That isn't caused by aging. Their genetics simply gave them either a lack of fat under the eye or a flatter cheekbone structure, providing less support and making the under eye shadow more prominent. People with deeper set eyes will also experience more shadowing because their eyes naturally sit further back in the skull. Aside from hollowing, another anatomical cause of shadowing is actually fullness. This might sound counterintuitive, but when you have excessive fullness under the eye, the juxtaposition of that fullness right next to normal facial tissue casts a shadow that looks like a dark circle. One cause of fullness is hypertrophy or thickening of the orbicularis oculi muscle. In medicine, we often lovingly refer to this as the jelly roll, a small thickening right under the lower lash line. Because that area is puffier, the region directly underneath sits in shadow, giving the illusion of a dark circle. George Clooney is actually well known for having a prominent jelly roll, and it obviously hasn't hurt his career. I will get into treatments for all types of dark circles shortly, but I do want to mention that this is probably the only time Botox is helpful for under-eye dark circles. You can inject Botox directly into that lower part of the orbicularis oculi muscle to shrink it slightly so it stops casting a shadow underneath. Now, the next cause of under-eye fullness and in turn dark circles is probably the most common one I see in my own practice. Pseudoherniation of the suborbicularis oculi fibroadipose tissue, also known as bulging under-eye fat. This can happen genetically, but it often becomes more prominent as someone ages and the surrounding tissues loosen. The fat under the eye bulges forward, casting a very distinct dark shadow directly underneath it. One way to test for this is to have someone gently close their eye while you delicately press on their eyeball. If you see that fat pad bulge forward, that is a strong indicator of what is causing the dark circle. Recognizing this cause is crucial because it does not respond well to tear trough filler. In fact, filler will not make it better. So many patients come into my office asking for tear trough filler when they actually have bulging fat pads. Adding more volume to an area that is already overly full is one of the worst things you can do. These patients often require surgery, which I will cover in a moment. Another factor that creates fullness and causes a dark shadow is puffiness from fluid retention. This happens for a variety of reasons. Consuming too much salt causes some people to get quite puffy under the eyes. Others lose the ability to maintain proper lymphatic drainage around the eyes as they age or due to genetics, leading to fluid pooling. Things like seasonal allergies, certain medications, and untreated thyroid conditions can also cause fluid retention and under-eye fullness. So, we have talked about hollowing causing shadows and fullness causing shadows. Another cause is simply having redundant excess skin. As we age, that skin loses elasticity and becomes lax. It tends to fold over on itself, which creates the appearance of a dark circle as well. When a patient asks me about correcting their dark circles, we evaluate all of these factors: the anatomy of their eye, their skin quality, and their lifestyle, including their sleep, stress levels, diet, medications, and underlying medical conditions. They all contribute. As I mentioned earlier, the under-eye area is complex and the causes are often multifactorial. That is why our treatment approach usually involves intervening from multiple angles. When someone asks me, "I've been using eye cream forever, why aren't my dark circles getting better?" we have to pause and educate them. It isn't just about skin quality or hyperpigmentation. Bone loss, fat bulging, and structural shifts all play a role, and each aspect needs to be addressed to get a satisfying result. On that note, let's talk about treatments for dark circles. First and foremost, if you have dark circles and feel unwell, if you are experiencing extreme fatigue, sudden weight changes, or night sweats, the first thing you should do is check in with your primary care physician. Sometimes dark circles are a symptom of a broader medical issue, and we don't want to miss that. If you feel crummy, start with your primary doctor. The vast majority of patients I see feel great, but they feel their under-eye area makes them look older, tired, or less vibrant than they actually feel. Now, my colleagues might disagree, but if I personally had an under-eye issue I wanted to address, rather than starting with a dermatologist, I would likely consult a plastic surgeon or an oculoplastic surgeon first, someone with specialized training in surgical corrections around the eye. The reason I say this is that most people who come in for an under-eye consultation have some degree of fat herniation that requires surgical correction, which non-invasive options cannot fix, or they have significant skin laxity that lasers alone cannot fully resolve. Surgery is often what is truly needed. I prefer that patients meet with a surgeon first, find out if they are a good candidate, and get educated on the procedure. People are often nervous about surgery near the eyes, but it is remarkably safe, far less invasive than most expect, and the downtime is usually quite manageable. If they determine they aren't a good candidate, or if they decide surgery isn't for them and want to explore non-surgical routes, then they come see me. If you have bulging fat or a significant amount of loose skin, surgery, specifically a lower blepharoplasty, is the gold standard. A surgeon can remove or reposition that excess fat to create a smooth, seamless transition. In my experience, the most dramatic, successful before and after transformations come from surgical correction. If you have structural hollowing under your eye, whether genetic or from aging, fat loss, and tissue descent, dermal fillers can be a great option to restore volume and eliminate the shadow. You can also consider autologous fat transfer, which involves taking fat from another area of your body, processing it, and injecting it into the under eye area to correct volume loss. Many patients request tear trough filler consultations, assuming filler is the ultimate fix for their dark circles, but 9 times out of 10, I do not recommend it. This is why I advise starting with a surgical consultation and working backward toward non-invasive options. Furthermore, if you have under-eye hollowing, you often have volume loss in other areas of your face that should be addressed first. The tear trough should be the last place we add volume. We always want to ensure the temples are restored and there is adequate cheek support before treating the tear trough directly. If you have mild skin laxity and a surgeon tells you there isn't enough excess skin to justify surgery yet, that is where laser resurfacing shines. Chemical peels, like TCA peels, are also very helpful for tightening the tissue slightly and smoothing out fine lines and wrinkles. If your issue is true hyperpigmentation, resurfacing lasers and TCA chemical peels can help. Specialized pigment targeting lasers like Pico or Q-switched lasers can also target excess melanin in the skin. However, keep in mind that the skin under the eye is delicate and does not respond as dramatically to lasers as other areas of the face. Expect modest, subtle improvements rather than total transformation. There is also some minimal data suggesting that platelet-rich plasma PRP injections can improve skin quality and hyperpigmentation in the under-eye region, which is why some practices offer it. Additionally, treatments like microneedling or radiofrequency devices can stimulate collagen production, thickening the skin for a firmer, more refreshed look. Just remember, these non-invasive treatments offer incremental gains. If you go into a consultation expecting the under eyes you had at 10 years old, you will be disappointed. Goal setting should focus on improvement, not complete reversal to your teenage years. That covers in-office options, surgery, dermal fillers, energy-based devices for collagen stimulation and resurfacing, chemical peels, and targeted Botox for the orbicularis oculi muscle. Now, I want to spend a moment on skincare and eye creams. You can't make a video about dark circles without talking about eye cream. The main takeaway here is that topical products are primarily for maintenance. You might see subtle improvements, but topical creams will not reverse deep anatomical issues like fat bulging, bone loss, or structural shadowing. Skincare can only target the uppermost layer of the skin. When choosing products for the under eye, the single most effective product is sunscreen. UV damage not only triggers pigmentation, but it also breaks down collagen, worsens skin laxity, and causes tissue to sag. If you do only one thing for your under eyes, protect them from the sun. Under eye concealer is another valuable tool that shouldn't be overlooked. I know you likely clicked on this video hoping to eliminate the need for makeup through skincare or treatments, and reducing makeup usage is a reasonable goal. But patients often tell me they want to treat their under eyes to the point where they never have to wear concealer again. I encourage a shift in perspective here. Going completely makeup-free isn't always realistic, and setting that as your standard can lead to disappointment. A better goal is simply wanting to wear less makeup while achieving a refreshed look. One of my all-time favorite eye products is the Colorescience Total Eye 3-in-1. It combines SPF 35 protection, a tinted concealer, and nourishing eye cream ingredients into a single product. It provides immediate cosmetic coverage while offering long-term sun protection and skin benefits. Many people I've recommended it to love how it instantly brightens while treating the area over time. While many active ingredients in eye creams can be found in standard facial moisturizers, many people prefer a dedicated eye cream step in their routine. If you are shopping for one, look for ingredients that stimulate collagen and elastin or help correct pigment. Retinol is great for this, and bakuchiol is a plant-based alternative that serves a similar purpose. Peptides and growth factors are also fantastic additions. While retinoids offer powerful anti-aging benefits, many people struggle to tolerate them around the eyes because they can cause irritation, redness, or dry eyes. If you are sensitive to retinoids, peptides, and growth factors are excellent alternatives. TIMECODES makes a fantastic top-tier eye cream utilizing growth factors, and elastin offers an incredible peptide-rich eye cream that is clinically proven to improve skin texture. Caffeine is another frequently marketed ingredient for dark circles, but I am still waiting for robust clinical studies proving its topical effectiveness under the eyes. It makes sense in theory, but the hard data just isn't there yet. If an eye cream contains caffeine alongside other proven ingredients, that's fine, but I wouldn't buy a product solely for its caffeine content. Finally, consider facial tools like gua sha or targeted lymphatic drainage massage around the eyes. This is primarily helpful if your dark circles are caused by fluid retention and puffiness. While it isn't a guaranteed fix, it is a low-risk, cost-effective routine worth trying if fluid buildup is your main concern. What has helped improve the appearance of your dark circles? Let me know in the comments below. I'm sure everyone would love to hear your experiences. Don't forget to like this video and subscribe to the channel. Thank you so much for watching, and I will see you next time.